Assalamu alaikum. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. In my previous class, I have discussed about the Plasmodium life cycle in case of malaria disease. Now I am discussing about the classification of the malarial drugs. Classification of antimalarial drugs, it can be classified according to the action of the malaria parasite life cycle. Number 1, tissue sysonticide. This type of drugs that acts on the developing tissue sysont. They are primaquine and proguanil. And blood sysonticide, drugs that act on the blood sysont. They are chloroquine, mefloquine, proguanil and pyrimethamine. Number 3 is gametocyte, drugs that destroy the gametocyte in the blood. They are artesunate, artemether, primaquine, chloroquine and mefloquine. And in hypnozoid stage or latent stage, that is primaquine. Now according to chemical nature, antimalarial drugs can be differentiated as follows. 4 aminoquinolone groups, that is chloroquine, and 8 aminoquinolone is primaquine. This type of chemical structure is present in these drugs. Aryl amino alcohol containing quinine and mefloquine, and phenanthrene methanol is halofentrin and lumefantrine. Now antimetabolites are proguanil, pyrimethamine, sulfadoxine and dapsone. And antibiotics also effective in case of malaria. What are they? They are tetracycline, doxycycline and minocycline. Now sesquiterpene derivatives, that is artemether and artesunate, and newer drugs are atofagone. Now what are the treatment of malaria? Treatment of malaria can be divided into two types, chloroquine sensitive and chloroquine resistant malaria. What is the treatment of chloroquine sensitive? In case of chloroquine sensitive malaria, we should give tablet chloroquine. First day 620 mg stat and then 310 mg after 6 to 8 hours. That is the treatment of first day. And in second day there is 310 mg. And third day there is again 310 mg. On fourth day, tablet primaquine, that is 15 mg per kg body weight up to 2 weeks. Why should we give it up to 2 weeks? Because in case of Plasmodium vivax and in case of Plasmodium ovale, there is latent state, that is hypnozoid. To eradicate this Plasmodium vivax and ovale, we have to give it for 14 days. Now number 2 is chloroquine resistant malaria, which is due to Plasmodium falciparum. It is also called complicated malaria and it is very fatal. In that case, patient may swallow or may not swallow. If the patient can take orally, we can give tablet form. Tablet form of quinine 600 mg base stat 8 hourly for 5 to 7 days. And then tablet doxycycline 200 mg once daily for 7 days, or clindamycin 300 mg 4 times for 7 days, or lincosamide 4 times daily for 7 days, or Fansidar 3 tablet single dose. Fansidar is a combination drug. Then number B is tablet malarone, that is atofagone and proguanil, that may be given 4 tablet once daily for 3 days. Tablet Riamate, that is the combination of artesunate and lumefantrine, 4 tablets stat, then repeat after 8 hours, then 24 hours, then 36 hours, then 48 hours and then 60 hours. Total 6 doses. And then tablet mefloquine also be given. If the patient is seriously ill, that the patient cannot take orally, then we should give injectable form. The first dose is injection quinine 20 mg per kg body weight as a loading dose and infused over 4 hours. And second dose is after 8 hours 10 mg per kg body weight as a maintenance dose. Why should we give it loading dose? Because its volume distribution is very high and it enters into the tissue. So for immediate action we have to give the loading dose, and then subsequently the maintaining dose will be given. After it should be continued for 8 hours until 8-hour interval until the patient can swallow the tablet to then complete the 7-day course. Then tablet Fansidar or doxycycline should be given subsequently. Now, what is the chemoprophylaxis of malaria? What is chemoprophylaxis? It is administration of drug in healthy person before infected, or there is any chance of infection. They can take this drug as prophylaxis. In case of chloroquine sensitive malaria, we can give tablet chloroquine 310 mg base before 1 week, and during the travel time weekly, and after the travel for 4 weeks. Then tablet proguanil 100 or 200 mg daily before plus during the travel and after 4 weeks of the travel. Now, chloroquine resistant malaria. In case of chloroquine resistant malaria, tablet mefloquine 250 mg weekly for 2 to 3 weeks before, during every weekly interval and after 4 weeks of the travel. Tablet doxycycline 100 mg daily before 1 week and during the travel and after the travel up to 4 weeks. Tablet Malarone 1 tablet daily 1 to 2 weeks before and during the travel and after the travel for 1 week. That's all for our session. Thank you.